I'm Jordan Duke.
And I'm Patrick Morris, and we're reporting from Channel 49 News.
Today we'll be looking at one of the most common injuries in professional sports, the torn ACL.
We have our sports reporter Vernon interviewing our two special guests.
They are experts in the field of sports medicine, and now I'm going to send it down to
Hey,
Vernon.
I'm Vernon. I'm with the athletic trainer and sports physician from the Carolina Panthers.
Hi, I'm Allie, and I'm the athletic trainer for the Carolina Panthers.
And I'm Marissa, and I'm the physician for the team.
Alright, so can you guys tell me what your job responsibilities are?
Well, while being on call as an athletic trainer, I would be the first responder on the field to any injuries. I would always be attending all sports events, help any and all players that have an injury, provide take care to all bodily extremities, and write up sport injury reports.
And my responsibilities include to direct the total health care of the athlete, diagnose the extent of the injury, recommend the follow-up care, remain aware of the rehabilitation process, and tell when the athlete can return back to practice or competition.
How many injuries do you guys see?
I would say the most common injury that I see is an ACL tear.
I have to agree with her, and also a concussion.
Tell us more about ACL tears.
Yes, Brandon. An ACL tear stands for anterior cruciate ligament, and that's where the ligament in your knee comes apart from the femur and tibia. My colleague here, Marissa, will go further into the surgical process of the ACL tear.
The surgical process requires the arthroscope attached to a video camera is inserted into the fluid-filled knee. Next, the surgeon inserts small instruments through a second incision, guided by the image on the TV monitor. The surgeon explores the menisci and, if needed, removes or trims damaged tissue.
So how do you keep the team healthy?
Well, Vernon, I have a three-part process. I make sure that the athletes have a correct diet, that they have individual and team exercise plans, and that there are no current bodily injuries keeping them from playing their best.
You two work together.
Together, we will observe the athlete's treatment for an injury, the rehabilitation programs, and if or when they can return to play their next game.
Hi, my name is Juwan Foggy. I'm a student athlete here at UNC Charlotte. I play football. And dealing with football, there's a lot of injuries that go on during that sport. I have had a torn meniscus. I tore my meniscus my junior year in high school. I was playing basketball, and it was around Christmas tournament time. And I want to say it was about the second game, and I came down awkwardly on my knee. And it was real awkward because it was a clicking noise that was going on inside of my knee. And it was able to play on it, and I just kept playing through it. I told the trainer that it was kind of fidgety and not right, and she said it looks fine to her, so I continue to play. So I continued to play the whole season, actually. Going through, all I had to do was just wear a knee brace on my knee, and I just kept going through it. And then track season came around where it's a lot more running going on, and my knee just couldn't take it anymore. So it was one practice, one afternoon after school, and I'm running, and my knee just stops completely, and I just couldn't go anymore. And so the next day I went to a doctor, and they told me I had to get arthroscopic surgery, which is this part right here in the knee, in this area. When I had to get my surgery, I had to deal with the arthroscopic surgery, and with that surgery, it's like a little device that goes inside your knee when they cut it open right here, and then there's like a little video camera that's inside the little metal piece. And it shows on a TV monitor inside the little surgery room where you have the surgeon and all his helpers in there with him. And they went in this part, well actually it was my right knee, but they would go inside the part of your knee and they go through and tear out the ligaments that need to be teared out and that need to be fixed. Another injury that would deal with arthroscopic surgery would also be a torn ACL. A torn ACL occurs a lot with women basketball players. Actually, they have the highest ACL injuries going across all sports. But it also happens in football. A lot of NFL players deal with a torn ACL, which doesn't heal well, so it also needs a very intense surgery. So with this surgery, they fix the tear part of your ACL. The recovery time for these injuries are very different. For a torn meniscus, I was out for a week. My knee had to unswell before I could start doing any type of recovery. So first off, when my knee started unswelling, I started walking again. And then after I started walking, I was able to start jogging 2 days later. And after several days of getting used to jogging and getting some lateral movements going on in my knee, I was able to start running again. And that was basically it for that surgery. But with ACL, it usually takes 4 to 6 months to get back to your normal self or to back to where it used to be.